We are covering blood donor phlebotomy, focusing on allogeneic and autologous donations for the phlebotomy exam. Understanding the distinction between these two donation types is critical, as the exam will test you on the specific requirements for each. Allogeneic donation is when a volunteer donates blood for the general population. Autologous donation is when a patient donates their own blood for their own future use, typically for a planned surgery. For allogeneic donations, the donor screening questionnaire is the first crucial step. It's designed to protect both the donor and the recipient by identifying risk factors. Expect exam questions about deferral periods related to travel, medications, or certain medical conditions. After the questionnaire, the hemoglobin pre-donation check is performed. This is a frequently tested area. For an allogeneic whole blood donation, a female must have a minimum hemoglobin level of 12.5 grams per deciliter, and a male must have a minimum of 13.0 grams per deciliter. A standard allogeneic donation collects 1 unit of blood, which is about 450 to 500 milliliters, over a period of 8 to 10 minutes. After a whole blood donation, there is a mandatory 56-day or 8-week interval before the next donation. This allows the donor's body to replenish its red blood cells and iron stores. Now let's contrast this with autologous donations. Because the blood is for the donor's own use, the criteria are more relaxed. This is a key concept for the exam. The minimum hemoglobin level for an autologous donation is lower, typically 11.0 grams per deciliter. This allows patients who might be slightly anemic before a surgery to still be eligible to donate for themselves. The donation frequency can also be more flexible, often weekly, with the last donation occurring at least 72 hours before the surgery. A common exam trap is to confuse the strict requirements of allogeneic donation with the more lenient standards for autologous donation. For example, a question might present a patient with a hemoglobin of 11.5 grams per deciliter. They would be deferred for an allogeneic donation, but could be a candidate for an autologous one. Another area of focus is the difference between whole blood donation and apheresis. Apheresis is a procedure where a specific component, like platelets or plasma, is collected, and the remaining components are returned to the donor. Donation intervals for apheresis are much shorter than for whole blood. For instance, platelet pheresis can often be done every 7 days, up to 24 times a year. The exam might try to trick you by asking about the donation interval for a platelet donor who just gave whole blood. They must still wait the appropriate time after the whole blood donation before donating via apheresis. To remember the difference between the two main donation types, use this phrase: auto is for me, automatically. Allogeneic is for all my peeps. This helps connect auto to self-donation and allo to donating for all others. For free practice questions, AI-powered explanations, and more exam prep tools, visit openexamprep.com. That's openexamprep, all one word, .com.